Hi guys, so I'm on a bit of a roll, so I want to keep it going. So I was talking about autism and narcissism, how they can overlap, but how a lot of people unfortunately fall victim and prey to the narcissist. Being more naive socially and more awkward, they get kind of scanned out and they get manipulated and abused because they're easier targets. I gave the analogy of like when a lion hunts a herd of wildebeest, they always try and wean out the weakest one in the herd, and that's what narcissistic people do with, you know, their victims. They don't go for the most confident, or the most, popular or handsome because they've got people in their corner as well. They try and go for the weaker people, get a group together, get people who are afraid to go against them. And then they've got backup all of a sudden, people who are afraid to turn against them for fear of rejection and retaliation. You know what I mean? And another one that I'm going to talk about now, which it's one that fascinates me, so I've been looking forward to this one, but it's going to be talking about autism and antisocial personality disorder. So it's going to be a very interesting one. And I've touched on both narcissism and antisocial personality disorder in other videos where I was talking about the penguin in Batman being very narcissistic, out for himself, out to get what he wants, and kind of differentiating between the two, so where he's quite cowardly, his self-preservation is quite high. Then looking at the Joker and how I believe he has antisocial personality disorder at its finest because he doesn't give a shit if the world burns with him going down with it. He's no regard for his own safety, but he's obviously very willing to use violence whenever it suits him. Whereas the penguin, strokes other people's egos and sucks up the people when he needs to get by and to survive. The Joker just doesn't care. He never strokes anyone's ego. He's always the same. He doesn't care who faces him. His attitude is always the same. He's at ease. He's relaxed. He couldn't care less. Even when Batman's beating the living shit out of him in The Dark Knight, he just laughs. He couldn't care less. A lot of people with antisocial personality disorder right here, they don't mind getting the absolute shit kicked out of them because they're very, thrill seeking and sensation seeking. They love the thrill of just the adrenaline of getting the shit kicked out of them almost. So yeah, it can coexist now with autism, but they can also take advantage of people with autism, and that's what we're going to look at again in this, the overlap, how they might look slightly similar because I did that with narcissism, where you've your routine with autism, so you have to have your own way. But that can be taught that you don't always get your own way. And that can be easily cut out, where you don't have a temper tantrum if you don't always get your own way. Um, but narcissists will keep being like that regardless, spoiled child essentially. But antisocial personality disorder is a very interesting one, and we're going to get into it now, guys. So it's an interesting article that I found here. And you can just check it out here, autismparentingmagazine.com, and then / autism hyphen antisocial hyphen personality hyphen disorder. It says it here, trying to differentiate between autism and antisocial personality disorder. We're going to have a look now. Scrolling down, I thought there was no more to the article, but thankfully there is. So here's an interesting quote that I found that I thought really, really interesting, and one that I'm kind of happy to hear, if I'm being honest. Autistic people and psychopaths are almost the opposite of each other. Good there. This remark made by Professor Baron Cohen, any relation to Sasha Baron Cohen, aka Ali G, aka Borat. Sasha Baron Cohen, what a guy. We gotta love him. What a character. But anyway, Professor Baron Cohen believes autistic people and psychopaths are almost the opposite of each other. remark made by Professor Baron Cohen during an interview for the Autism Parenting Summit, September 2022, is enlightening and may be especially relevant to parents of autistic kids pondering possible links between antisocial personality disorder and autism. Professor Baron Cohen shared his opinion while answering questions about his book, The Pattern Seekers: How Autism Drives Human Invention. He spoke about empathy and how those with autism spectrum disorder may struggle with cognitive empathy but not effective empathy. Thank you. I love this guy. I love Sacha Baron Cohen and I love Professor Baron Cohen. It's not that we don't have empathy, it's that it's often not shown. It's hard to express it. You know what I mean? We don't know what the appropriate response is. And I say we, it's a spectrum, of course, but it's not one size fits all. Like I'm a hugger now, but I had trouble with that before. Now I never miss a chance to hug people because I was awkward. I want to make up for lost time, and be as affectionate as I can now. So you can learn those things. What's appropriate maybe for others and what's not. Someone with antisocial personality disorder, by the way, does not care what's appropriate for others or not. It's the very nature of it. It's not that you're antisocial in the sense you don't like socializing. That would be asocial. Someone who's antisocial commits crimes against people, deceives people or harms people. So just scroll down here. Effective empathy, illustrated through appropriate responses to the thoughts and feelings of others, is intact with those with autism. According to Professor Baron Cole, some autistic people may struggle to read facial expressions and gestures, but once they know someone is in distress, they will most likely respond and act with appropriate care. 100%, yeah. If I know someone's in pain, I'll try and fix their suffering. Bullet to the head. I'm just joking. I'm just joking. Cognitive empathy, explained in the interview as putting yourself in someone else's shoes or taking their perspective, is often an area of difficulty in autism spectrum disorder. So, like, understanding how someone is feeling, it's like, so I think he makes a good point there. It's, I don't know how you're feeling, but if you tell me you're upset, I will try and help you. I'll feel, oh, this person's upset. I'll try and fix it for them. And I mean, I can relate to this even now, and I've done a lot of work on this, but even sometimes I still get confused. It's like, what's the person feeling? What do they want me to do in this situation? It's just ask. Sometimes it's just easier to ask and to communicate, you know, are you okay? Would you like me to do anything? And it works perfectly. Best thing I've found anyway, for sure. So yeah, cognitive empathy, putting yourself in someone else's shoes or taking their perspective can be an area of difficulty in autism spectrum disorder. In contrast, however, a psychopath may excel in this area because reading the minds of others is often necessary to manipulate. And that's the thing that I was saying about narcissism. They're brilliant at reading people. Now, these are different conditions, I might say. So, both highly manipulative, but for different reasons. Someone who, and they say psychopath, but they're talking about antisocial personality disorder. I think they often get that wrong. I think because I've looked up the DSM-5, the Diagnostic and Statistical Manual, fifth edition. They don't recognize psychopathy or sociopathy, and especially not sociopathy, as medical terms. It's antisocial personality disorder. That's what they will put down as the diagnosis. They won't say psychopath. So why they keep using it, I don't know. But for argument's sake, that's what we'll use. But it's not referring to narcissism. It's referring to antisocial personality disorder, I believe. Yeah, and I could be wrong, but that's what I believe because that's what the article says. So it's necessary, though. You need to know what the person you're manipulating is feeling so you can, play tricks on their mind. And that's what people who are narcissistic and antisocial do brilliantly. They're very good at it. This is why autism may be thought of as the opposite of psychopathy. Difficulty in understanding the minds of others would make it tough for someone on the spectrum to manipulate and deceive. There you have it. It's like we see someone with a lot of emotions coming at you, and it's funny because like, I'd be quite an emotional person myself, and I've got borderline traits like diagnosed. So obviously there's high emotions there. I can do the opposite as well though, and I can override the situation and do too much, and I've been guilty of doing that only recently, where I think someone wants me to do everything for them and they don't. So there you go. That's a an interesting one. But you're like, what do you want me to do? I feel uncomfortable because I know you're in discomfort, but you won't tell me what's up with you, and I can't read your mind. I don't know what you're feeling. And sometimes my family will go, "Oh, it's obvious." It's like, it's not to me. You've got to be clearer with me. So I think credit to Professor Baron Cohen. He's done a brilliant job here highlighting it. Bravo, sir. Shout out to the Baron Cohen family. Yeah, but that's the thing. You have to be able to understand what the person you're manipulating is thinking so you can start messing around with their head. You've got to understand what way they're feeling. Um, so this is why autistic people might be thought of to be the opposite to those who are psychopathic or antisocial, as we'll use, because autistic people can't read what's going on in someone's mind. But once they understand that someone's in pain, they try and help them out. Whereas someone who's antisocial can understand exactly what's going on in someone's mind and will use that to manipulate and torture them, essentially. You know, the struggle with social communication and interaction is probably the reason autism is sometimes wrongly linked to antisocial personality disorder. That is not to say that antisocial personality disorder and autism can't co occur in an individual. Rather, it's important to realize the two conditions are distinct and not related to one another. Exactly. Like that's what I was saying in my video on narcissism. The two are not interlinked, you know. I was talking about alexithymia. That's a condition where you're emotionally blind. So that can look quite psychopathic, where you're very flat, you've got a bit of a stare, your emotions are very numb. And in someone who's psychopathic, they're going to be quite eerie because they're not going to feel a whole range of emotion. They're quite cool, calm, and collected. So quite scary individuals to be around. But they don't coexist. You know, you don't have to have one and then have the other one. You can't have one without the other. Autistic and psychopathic traits may, however, overlap, which is why it is important for parents to know the differences between autism and personality disorders. While psychopathy bears traits to various personality disorders, it is important to note that not every person diagnosed with antisocial personality disorder is a psychopath. That's what I was saying. So there we go. They've had the distinction there. Abdallah, Philo, and Volm looks kind of Finnish, if I had to guess, and then German and the other. Personality or autistic disorder. So let's have a look here. Autism is a developmental disorder characterized by persistent impairments in social communication and restricted repetitive behaviors or interests. DSM-5, American Psychiatric Association 2013, includes specific criteria for autism, including the requirement that symptoms should be present from early on, even if full manifestation only occurs later. So symptoms occur in childhood. If you're antisocial, you have to be 18. Yeah, it says it right there. ASPD, antisocial personality disorder, only possible after the patient reaches 18. You would have conduct disorder before that, a persistent pattern of violent, there we go, right there. Yeah, up to 15. Antisocial personality disorder, ASPD, on the other hand, is a mental health condition that is not diagnosable in childhood. Before a child reaches adulthood, diagnosis of conduct disorder is necessary before the age of 15, which could then convert to ASPD if antisocial behaviours persist. Black, 2015. Interesting, yeah. Very interesting. The DSM-5 criteria for ASPD includes a pervading pattern disregarding and violating the rights of others from the age of 15. Three or more indications of such behaviour should be apparent, such as failure to conform to social norms, disregard for the safety of self and or others, impulsivity and aggressiveness, irritability. These people, they're very much, violence is the instant answer. So I think another key distinction that maybe Baron Cohen doesn't mention there, love you, your stuff is great, but one that I would add to that, I'm just going to get a bit of water before I do, is that to make sense of the world, autistic people, and I can testify to this as someone who has been a bit of a rule breaker in the past. Sorry, guys, but we like rules. Definitely, it's nice. If something is meant to be done that way, I will do it that way. No problem. Someone with ASPD, their very existence is to violate rules. So that's a real key distinguisher. So if you got the two of them, geez, you must have a hell of a lot going on inside your mind. But they are very defiant of authority. They hate teachers, parents, police. There's just a need and impulsivity, thrill seeking behavior. So just getting into fights, robbing stuff, taking drugs. Um, and as it says there, because they've no regard for their own safety, they can do damage to so many people, including themselves, and they often do, you know, dangerous individuals because of this. And I guess how would this show up in reality? So if you say something to piss them off, and I've seen it before with people who would be quite not you couldn't diagnose them because I'm not a psychiatrist, but they come up to you and the eyes are intense. Like, what you fucking say? You want to go? They're looking at you and they're eyeing you up and down. It's like, oh, you're shaking. Look at you. You're afraid of me, aren't you? And then they're eyeballing you and they're smiling. They're showing that they're not afraid of you, but they want you to be afraid of them, and they know you probably are because it's the calmness they say stuff with. They're really calm. There's nothing. There's no change in expression on their face. They're gonna test you to see if you're gonna break, and it's be like, come on, what you fucking say? Come on, what was that? And then they'll see if you say it as confidently. They're great at picking up on stuff like this. If you delay your answer and you're kind of like, oh, got them, they're great at indicating to themselves, this person is afraid. Now I've got them on the back foot. They're not confident. I have this person. They seem to get a thrill out of, you know, putting fear into you. And they're good at doing that. They're very good at doing that. And they don't seem to have that fear in them, which can make them extremely dangerous. The diagnosis of ASPD is only possible after the patient reaches the age of 18. Before reaching adulthood, the presence of a conduct disorder should be evident, typically appearing before the age of 15. The symptoms or appearance of antisocial behavior should not occur only as a result of schizophrenia or bipolar disorder. So, if you had schizophrenia, you might have a paranoid delusion, and you might think somebody's trying to kill you, so you kill them. That's very violent, yeah. And some schizophrenic patients have delusions and hallucinations so significant that they commit very violent crimes, but there's not a pattern of it. You know what I mean? And I've heard plenty of forensic psychiatrists saying most schizophrenic people are not violent, but when they commit an act of violence, it's horrific, because they think there's demons or, the devil talking to them, aliens trying to abduct them. So it's extremely violent, but it's a one off. You know what I mean? It's not a persistent pattern of bad behavior. And then with bipolar disorder, I spoke to my friend O'Shane about this, and he was on the channel, hoping to get him back on in the future. He's doing very well now, thankfully. I went out to see him Friday, just gone. It was great meeting up with him again. But he says there's a lot of risk taking behaviour, and he very open about it, in fairness to him. If you want to check out that interview that we did, it's autist meets bipolar. But he said that it's like nothing is a bad idea. Everything you do is a good idea. You know what I mean? So the risk taking behavior and disregard for self and others would show up with bipolar. I'm sure he'd agree with me on that. And you can get quite agitated and irritable if people disturb you. He said, if I've got a goal and you disturb me from my goal, this is his words, he's bipolar, not me, but he said it. If people get in my way when I'm manic and I'm having a goal, I get very agitated. It's like, oh, interesting. Yeah. But there's not necessarily a need to do violence or a impulsivity to do violence like you get in ASPD, or that lack of empathy. People with bipolar can be empathetic, but when they're manic, they're very grandiose. I need to do this, there's a message from God. It can be that extreme, or the devil. Again, hallucinations, delusions. Psychosis, can occur in schizophrenia and bipolar, and you don't have to have schizophrenia with bipolar to have it. Can have bipolar disorder or have psychotic episodes, which would be seeing or hearing things that aren't there, believing people are out to get you when there's no evidence of that, like paranoia. Looking at the criteria and characteristics of ASPD, a picture of willful exploitation, violation, and manipulation of the legal rights of others with no remorse emerges. The manifestation is distressing as we are conditioned to follow the social norms. Generally, people want their social image to reflect that which is desirable and acceptable by others. And there you have a clear distinction from antisocial and narcissism. They want to be desirable. They are desirable, but they want people to admire them, they want to be accepted by everyone because they feel they deserve it, but they also put on a show. Someone with ASPD, antisocial, they don't give a fuck. I don't give a fuck. I don't. But you see how they don't care? It's just willful, as they say. They'll do it because they want to do it. They know it's wrong and people don't condone it, but they don't give a shit, you know? So I want something, I'm going to take it. I'm bigger and stronger than you. I need money. I'll beat you up and take your wallet. And I don't care if I get caught doing it. Now, a narcissist might do the same thing, but not get caught because then people would think less of them beating up a weaker person. Whereas someone with ASPD, they think to themselves, I want this, I'm fucking taking it. I don't give a shit who's watching because I don't give a shit about the consequences either. And I saw that when I was doing a video with Carl Panzram. Yeah, if anyone remembers that, he clearly did not give a shit about any of the consequences because he was beaten senseless and tortured, but he kept doing what he was doing with no regard for others. Moreover, as humans, we seem to have an innate desire to belong, to connect. We crave approval and act accordingly to be accepted in our communities. Antisocial behaviour seems at odds with such desires and raises questions about the reasons behind such deviations from social norms. Yeah, so like if you want to belong to a community, you've got to give something to that community. But these people will just exploit. They'll take, they'll beat you up, they'll rob you, they'll deceive you. I remember it was called quite a parasitic type of lifestyle where it's just take, 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 but no give at all. You know, they'll take credit for your hard work, they'll rob, they'll cheat, they'll do whatever to get by. Impulsive. It's got the highest comorbidity of any mental health condition with addiction, I believe, because it's just thrill seeking. Again, there's a deep emptiness in someone with ASPD. They're quite nihilistic, you know. They see the world as an evil place. So rather than, and here's another distinguishing fact from narcissism. I've heard plenty of people with antisocial personality disorder say, I don't think I'm great. I know I'm a piece of shit, but I know everybody else is a piece of shit too. I'm just not pretending to be good. You know what I mean? And that's very interesting to hear that they think like that. So there's not narcissism there, but there's a sense of you've got to take what you can get. It's a dog eat dog type of world. Everyone is bad. There's just people who are willing to admit it, like I am, and then there's those who want to live in dreamland. It's interesting. Certainly a very interesting condition. I find it very fascinating. Although the genetic influence and hereditary of antisocial behavior has been established, Baker et al. 2006, research also shows greater adverse childhood experiences may be associated with an ASPD diagnosis. The link between sexual abuse and a diagnosis of ASPD is not surprising. One can imagine the development of hostility to authority when caretakers are responsible for such distress. To Lizzie et al., 2019. And that's exactly it, right? So it's easy to go, this person is a monster. They don't follow the rules, they exploit others, they take from others. If you go back, though, to Michael Vanzram video, The Meanest SOB that ever lived, which is what he called himself, yes, he did horrific things, but he also had horrific things done to him as a child. He was deprived of food. He was chained to radiators. He was made to work on a farm and then go to school with only like 2 hours sleep. He was beaten, he was raped. That's another, I should have said RAP, but yeah, he was taken advantage of. I'm not monetized yet, so I better get all these big videos out. But if you can picture someone like that as a child and the damage that was done to them, it's very hard not to empathize with them. The hard part for me is you've got to remember that they're exploitative, they're manipulative and they don't have empathy or lack of empathy, I should say. But so if you do show them empathy, they'll use it against you, which is the hard one for me because you're like, this poor human being went through torture, but how do I know they're not trying to manipulate me when I try and help them? How do I know that? It's very hard to tell, but usually there is a link of the worst possible type of trauma you can imagine. Violence begets violence. People would say, well, it happened to you, so why would you do it to other people? That's not how it works. It's a case of it happened to me, so it's the norm. And if it happened to me as a child when I should be protected, well, then I'm going to do it because it's fine, isn't it? That's how they seem to see it anyway. But then we get to conversely, while trying not to generalize, a definite pattern of desiring to fit in socially emerged in many conversations I've had with individuals on the autism spectrum. In fact, most autistic people I've interviewed spoke of a deep need for connection and belonging. Because of communication and sensory struggles, social interactions may be challenging, but despite such struggles, a desire to connect with others means many autistic individuals often mask their symptoms simply to conform to social norms. And I would 100% agree with that. I've done it my whole life. So, yeah, absolutely. I've always wanted to fit in, just didn't know how. With antisocials, I think with that level of damage done to you as a child, you can imagine, you think the world must be evil. Like, you understand why they'd be nihilistic. You're a young child and someone takes advantage of you in the worst possible way. I'd certainly struggle to believe the world was a happy place, wouldn't you? So my heart does go out to a lot of these people, but you also have to remember they're very dangerous. So you have to be cautious around them. Cautious kindness is what I say. Anyway, as we go on, in an attempt to foster friendships, autistic children may force themselves to maintain eye contact, despite experiencing severe physical discomfort. Can also relate. This is but one example where socially acceptable behavior is adopted not to deceive, but due to a genuine desire to conform to neurotypical norms to gain social acceptance. Yeah, we just want to fit in. Um, so I would copy a lot of what I'd see other people doing, not to manipulate, but to conform, as they say. An area which would benefit from further research in possible link between abuse of autistic individuals and whether this contributes to the risk of personality disorders. We do know children with autism are at a heightened risk of maltreatment, and this may lead to increased aggressiveness. McDonald et al. 2019. The long-term effects of such maltreatment and the implications for personality disorder development in ASD deserves further investigation. Very interesting. Yeah. Okay. And then we get to the overlap. Overlapping symptoms and comorbidity. Aggression may be used as an example to illustrate how autism and ASPD symptoms overlap. It could also show how an overlapping characteristic of behavior is motivated differently. And there's the interesting one now: aggressive and violent behavior in ASD and ASPD. Aggression in early adolescence may predict ASPD, Whip et al. 2019. Research also shows prevalence of aggressive behavior in children and adolescents on the spectrum is high. Sorry, just getting an itchy nose, getting hay fever. So, research also shows prevalence of aggressive behavior in children and adolescents on the autism spectrum is high. Some studies reporting 68% of participants demonstrating aggression to a caregiver. Can and Missouric, 2011. This kind of antisocial behavior is an area where autism spectrum disorder, ASD, may overlap with ASPD. So, yeah, I don't remember ever really being aggressive with caregivers. I was aggressive with other kids, absolutely, yeah. My brother would say that I was aggressive with him, which I really regret. A lot of other kids giving me shit as well, and I would flip out and lose my temper with them badly. Sometimes I didn't want to go somewhere, and I'd be dragging up my mom saying I don't want to go there, or SNAs, special needs assistants in school, because it just felt like I was being spoken down to. But I don't remember being very aggressive in that way. I was aggressive in general, though, and I remember being in a lot of trouble for fighting with other kids or hitting them, and usually doing more damage. But I learned it wasn't socially acceptable, and I've empathy. So, I wasn't going around beating up people because I could. I was doing it normally because they were pissing me off. So, say that was the difference. Like I've learned in the workplace, to fake it till you make it, as they say, and just put on a brave face and not argue. If I was ASPD, I'd flip out and just lose my temper impulsively. And I have acted impulsively before, but I think in general, I'm quite good at managing that, considering where I was at, and a lot of people gave me shit, so I think I'd have a good reason to do it. Yeah. So here we go. It's important to look at the reason for the aggressive behavior, especially when following therapists' advice that all behavior is communication. If prevalence, sorry, if prevalence of aggression is especially high in autistic kids with more social communication problems, Can and Missouri 2011, one could speculate about aggression as a form of expressing pain, discomfort, or sensory stimuli experienced as threatening. Exactly. This environment is too uncomfortable for me. Autistic meltdown, not that I'm just losing the plot for no reason. This situation is too uncomfortable. I can't cope with it. That's why. Then it's too loud, it's too bright. My clothes, the sensation, I'd always be scratching myself and fucking hated the clothes. And unfortunately, exposure therapy, that's all that worked. Just had to keep doing it. But I never just hurt someone for the sake of it, which is what you'll see with a lot of ASPD individuals, where there's just this outward aggression and they don't care who they hurt. No, no one is a monster. And if anyone presents and wants treatment genuinely, help them out. Unfortunately, it might be very difficult with these individuals because, again, it's different to narcissism, but they don't see themselves as the problem. Everyone is evil. That's what I get anyway. Like, anyone know more? Leave it in the comments below. I'm just speculating here, but from what I've seen, they don't think that they're superior to anybody else. But it's a dog eat dog world. I have to take what I can get, and you can imagine they're going through a lot of pain if they want to take drugs and alcohol all the time and just live in the moment, because going back in the past, going into the future, they can't plan ahead. Very impulsive. Narcissists can be quite successful, but antisocials typically not, because they're very violent, they're very impulsive, they don't plan stuff out well. They'll just smash and grab. Let's say like the narcissist is the bank job, the Ocean's 11 type, whereas antisocials are more smash and grab, with the shotgun type of behavior. I want, so I'm just gonna fucking take it. I'm not gonna think it out. I'm just gonna do what I want. And locking them up in prison doesn't seem to have any effect on that, which makes them worse, I'd say. Speculating about the reasons for aggression in ASD does not alleviate the hardship the behaviour bestows upon families and individuals themselves, Aggression is often expressed in a self-injurious manner, so self-injury, makes sense. In fact, aggression is often listed as one of the most distressing challenges ASD families experience. Encouragingly, families report addressing aggression with some success with intervention targeting underlying problems like sleep disturbances and gastrointestinal issues, both of which I've experienced. Well, here we go, we've got more. Aggression in ASPD may be motivated differently, with some experts providing reasons like impulsivity and substance abuse as motivating aggressive behavior. Yeah, in fact, I would love to know if you were able to treat the addiction, could you remove the extremely aggressive and violent behavior? Because you've got someone who's very impulsive, but you've also got them now disinhibited by alcohol or drugs. A lot of people who aren't antisocial commit violent crimes when they take drugs. So if you were to treat that, do you think you could, maybe get them to channel their aggression in a different way? Maybe, people do a lot of very fucked up things when they're on drugs. If a child is genetically predisposed to personality or conduct disorders and grows up in a chaotic, abusive environment, it may not be surprising that as an adult they demonstrate violent and aggressive behavior. Such behavior may be exacerbated while under the influence of alcohol or other substances. Interestingly, in some countries, almost half of all violent crimes involve alcohol intoxication. Van Amsterdam et al. 2020. Obviously Dutch. Van Amsterdam et al. Comorbidity of ASD and ASPD. Not only do symptoms of the two distinct conditions overlap, a dual diagnosis of autism and ASPD may be common in forensic settings. Carty and Murphy, 2021. 2021. Such a dual diagnosis is difficult to assess because a lack of clinical guidance on the assessment of those who present with both personality disorders and ASD. So there's not an awful lot of clinical research done on people who have autism and also other personality disorders. Like, for instance, I have borderline traits and I have autism. So not an awful lot to go on, sadly. So I'm kind of struggling to find my place in the world, but we'll get there eventually. Establishing the sensitivity of diagnostic tools like the Autism Diagnostic Observation Schedule, ADOS, ADOS, and the International Personality Disorder Examination, IPDE, those with comorbid ASD and ASPD still needs to be undertaken. Carty and Murphy, 2021. Definite difference. Equating the social interaction deficits in autism with an antisocial personality disorder is inaccurate and it may be harmful, adding to the stigma experienced by those with neurodevelopmental conditions. Yeah, so it's not like they're all going to be violent, you know what I mean? Those with autism, but struggle, and the stimuli may be too much around them, the external stimuli. Perhaps the solution is to adopt a solution Perhaps the solution is to adopt a solution suggested by research by accurately diagnosing the type of empathetic deficit, psychopathy, or ASPD could be differentiated from autistic disorders. Hansman and Vinans and Hubbelin, 2006. Hubbelin. After all, as the researchers Hansman, Vinans, and Hummelin 2006 explained, the innocent inability to take the perspective of another, often found in autistic individuals, differs substantially from the psychopathic trait of insensitivity, the inability to feel with another. And there's all the people who you'd have a look there. Very good article, I have to say. Don't need to post a comment, so that's from signfamily.com, Antisocial Personality Disorder and Autism. Understanding the differences. Right. Yeah, so you can kind of see it there. Where someone with ASPD might pick on someone with ASD, some antisocial picking on autism, is the really aggressive style. And I see a lot of people who aren't comfortable with confrontation with autism, I might just say, because they get taught a lot of bullshit, like the pansy, don't attack type of approach, and it was certainly bedding to me, not literally, well, in some cases literally, but someone with autism will try and conform to the rules, especially if high functioning, because nothing makes sense. So having the rules, that makes sense. But then people don't follow the rules, and people with ASPD certainly don't follow the rules. So they don't give a shit, and they will trample all over your rights. They'll use violence, they'll use aggression. People are often very uncomfortable when someone's extremely aggressive, and that's what you're going to see with someone who has ASPD is very heightened aggression. And give me that. Trying to intimidate you and to take what's yours, or getting into a fight with you, smashing stuff up, not really caring about breaking things, or just extremely antisocial behavior, that would deviate from what a normal, decent human being would do or be expected to do. Violating others' rights, though, like, so you try and have empathy for everyone, but if someone's condition is ASPD, then they must violate people's rights in one way or another. Deceitfulness is another thing. Not a con men and women have ASPD, where they're manipulating, they're running scams, they're taking from others, they're parasitic in nature. So being autistic and being naive, someone who's antisocial could rip you off, or they could take advantage of you and just take from you. They see someone who's got a vulnerability, they're going to take from them. You or I might not, because we think it's wrong. We might take from someone who's just as capable as us because we think it's fair game. They're going to see a weakness, and like narcissists, they probably won't go for the strongest person. They'll go for the weakest and try and manipulate them. But there seems to be a definite fearlessness with antisocial personality disorder. Like they'll fight anyone, because they're just wired differently. They don't give a shit if they get the crap beaten out of them because it's a sensation. They'll just keep coming back for more, But as neurodivergents, we've got to be aware of these people because they can look at us and sense weakness in the way that a narcissist might, and they can take advantage of us, rob from us, that's a very antisocial act. They can take our belongings, they can take from us, if we're not willing to stand up for ourselves, they'll just keep taking. Don't expect them to stop because we try and appeal to their better nature. They don't have one, unfortunately. So mind yourself, guys, and I hope you're staying well. It was an interesting one, a very good article there. I hope you enjoyed it. That was ASPD versus ASD. Okay, slán go fóill, guys. Hope you enjoyed.